Hi everyone. I'm always asked, is there a non-surgical way for skin tightening? A lot of people don't want the scars or the downtime of a surgery, and they just want a quick and dirty way of tightening their face or tightening the loose skin on their arms or legs, the anterior thigh, that chicken skin that kind of gets ripply over time with age. And I can tell you we have two methods of tightening the skin without scarring and with minimal downtime. One of them is Morpheus, that's on the top of the skin, and it's a radiofrequency microneedling that tightens the skin by reorganizing the collagen over time. It's usually 3 to 5 sessions depending on how loose the skin is, and it's done on monthly intervals and with numbing cream. And you really don't need pre-medication, but we do have Pronox if somebody is really squeamish. It does do a really good job on like mild loosening of the skin of the arms and legs that comes with 40s and 50s, or with the weight loss that happens at any age that loosens the skin. We're doing a lot of it on the face where we need tightening in the jawline and the neck and also the cheeks, so that you get that youthful appearance after you've lost about 10 to 20 pounds with the GLPs. A lot of people are worried they're going to lose fat in the face, but that's basically bad information. We control the depth of Morpheus, so we would never go down to the fat layer in the skin. On the face, there is a fat reduction Morpheus tip that's for the body. And if somebody wants to really lose some fat in their face and they have really full face, sure, we can go deeper and get rid of some of the fat. But as a rule, the Morpheus 8 that's for the face is just for skin tightening, doesn't go deep enough to devolumize your face any further, and it does a really nice job without much downtime. The surgical option is Renuvion, which is a really nice way of just tightening skin from underneath the skin. And then sometimes we do a sandwich procedure where we do the Renuvion from underneath and the Morpheus on top, but it's usually done in surgery because it's a tumescent technique that needs to be done where we infiltrate fluid under the skin before we shrink it. The scars are minimal. They're like liposuction scars. You would need some very mild sedation, or you could do it with just oral sedation and local. It's a very nice way of shrinking skin that is moderately loose. And these patients are very different than Morpheus patients. They need a little more tightening. And these are the candidates that we usually recommend Renuvion and not just Morpheus or a combination of these two procedures.